Hi, welcome everyone. My name is Bevan Bukeister and I lead the Water Policy and Learning Network at the National Governors Association. On behalf of NGA and my colleagues who helped plan this meeting, Jessica Rackley, Program Director for the Environment and Energy Division, and Brittany Roy, Program Director for Public Health, and Alex Whitaker, Legislative Director in our Office of Government Relations. I want to welcome all the governor's water advisors, health advisors, and state and federal representatives attending this meeting and provide you with a bit of background on the National Governors Association. We're the nonpartisan nonprofit organization serving the nation's governors since 1908. Our government relations side works to ensure governors' views are represented in shaping federal policy. And my colleague Alex Whitaker has worked for years with governors, state and federal representatives to inform them about federal actions on PFAS by EPA and DOD and track CDC health studies. NGA Center for Best Practices, where I run the Water Policy Learning Network, works with governors' advisors to examine the most pressing issues they face and to identify solutions that states can adopt. We focus on several issue areas like environment, health, energy, education, economic opportunity, homeland security, and infrastructure, to name just a few of them. And our Water Policy Learning Network has been working with governors' water advisors on PFAS issues for several years and exchanging best practices among the states. The issue of PFAS in drinking water and in all other water, groundwater, effluent, and agriculture and air is important to governors. It's important because the health of their constituents depends on clean water for drinking, cooking, recreating. It's also important because it impacts water affordability, which is made less affordable when they need to adopt multi-million-dollar fixes and cleanups are needed. It's also critical for healthy habitat, for aquatic life, for birds, and for agriculture. And clean water is a foundation to grow a robust economy. So governors have been taking action on PFAS for years to protect their residents. Some of these actions include creating short or long-term task forces to coordinate agencies and stakeholders. In 2015, Governor Cuomo of New York established a water quality rapid response team after PFAS was discovered in Hoosick Falls, New York. In 2017, Michigan Governor Rick Snyder created Michigan's PFAS Action Response Team, or MPART, that brought together 4 agencies to coordinate their response. And then in 2019, Michigan's newly elected governor, Gretchen Whitmer, made MPART a permanent advisory body and added several other departments. Other things that governors have taken action on are requiring systems to monitor more for PFAS. So in 2018, New York required all water systems to monitor for emerging contaminants that were covered in EPA's unregulated contaminant monitoring regulation. And they required it every 3 years, whereas EPA required systems 10,000 and over to test for this contaminant every 5 years. So most of New York systems are smaller than the 10,000 threshold. So New York required all of them to study. Governors have also banned PFAS in certain products. In 2018, Washington's Governor Jay Inslee signed a law banning the use of PFAS in food contact paper by 2022, and another law that banned the use of PFAS in firefighting foam. Governor Walz of Minnesota signed a similar bill banning the use of firefighting foam containing PFAS in 2019. Governors have also pushed to set regulatory drinking water standards in their state that limits the allowable concentration of PFAS in drinking water. New Jersey and Vermont set drinking water standards for several PFAS compounds. Other states have proposed drinking water standards, and they're not yet final. Those states include New York, Michigan, Massachusetts, Minnesota, Rhode Island, and Vermont. New Hampshire adopted a groundwater standard that applied to wastewater discharges, and they've been held up in court until further economic evaluation is completed. In addition, several states adopted health-based advisory values for PFAS in drinking water supplies. And in 2019, a bipartisan group of governors sent a letter to Congress asking them to make EPA set a drinking water standard for the nation to limit the concentration of PFAS in water. So governors have a great interest in this topic and an important role to play in setting state and federal policies. So we recognize that the job that you all have in supporting your governors is translating sound science into public policies. We also recognize the science is never complete. There's always more to study. And that means you all need to make a judgment call on whether there is enough science to serve as a solid foundation for public policies. And we recognize that this judgment is going to be different in different states. And that's why we are very happy to partner with Rebecca Eicher and the American Association for the Advancement of Science to look into the science behind the policies and to bring together the governor's health and water advisors to provide you with a common background and the science behind the health impacts, update you on the federal actions on setting limits for PFAS in drinking water, provide you with new contacts to help inform your policymaking, and to find out what other information and assistance you might need from the National Governors Association. So with that, let me turn it over to Rebecca from the American Association for the Advancement of Science's EPI Center.
Wonderful. Thank you, Bevan. That was a very thorough introduction to the PFAS policy landscape. I wanted to just take a couple minutes to introduce all of you to AAAS, the American Association for the Advancement of Science. We are the world's largest multidisciplinary science organization with over 120,000 members in over 90 countries. And we have numerous affiliate organizations or other scientific associations that we work with. The AAAS EPI Center, or the Center for Scientific Evidence in Public Issues, is a part of AAAS. We're a relatively new program, and our mission is really to make it easier for policymakers and other decision makers to access relevant scientific information and integrate that evidence into their decision-making process. We're a nonpartisan organization, and the EPI Center works to be timely and nimble, so bringing you current scientific evidence on policy issues that you're working on right now. We also bring a multidisciplinary perspective, and our real goal is to make sure that the science that we help bring to you is clear, concise, and actionable for your work. We work on a number of different projects. And so Bevan mentioned that we're here to talk about PFAS in drinking water today. We also work on orphaned and abandoned oil and gas wells, voting technology and election security. We're kicking off a project on green stormwater infrastructure. We've done some work on artificial intelligence, as well as substance use disorder and treatment, and getting started on some work in structural racism and policing. So for us here at the AAAS EPI Center, what we've been doing is trying to help decision makers from the local, state to federal scale have a better understanding of the scientific evidence that's available and connect with each other to learn from other decision makers that are working on this issue. We created a set of guides specifically for local and state leaders that is available on our website. And you can download that guide, and it covers everything from the scientific evidence to risk communication. We're also working to convene scientists, engineers, and policymakers in venues like this to discuss how to address PFAS. And we're working to support collaborative relationships to address this problem throughout the country. So with that, I think I'll pass this over to Maya to kind of get started on the details of the session, and then we can get right into the scientists and other experts that are here to talk to us today.
Great, well, thank you so much, Bevan and the National Governors Association and Rebecca and the EPI Center. I'm really happy to be here. As Rebecca said, I'll be helping to facilitate the sessions today. And so just wanted to start out really excited to see the number of folks we have in the room today. We have 74 participants, attendees, as well as our 13 panelists. So really excited to have so many people here. I think it really kind of points to the importance of this issue. Just in terms of what we're planning to do, Bevan already provided a high-level overview of the session today, but you should be able to see the agenda on my screen, and it was also sent out in advance of the session today, along with the participants list, the PFAS the participants list and a speaker bios. So during today's session, we will start out with a series of presentations providing that introduction to PFAS in drinking water, and particularly the human health impacts. So Tom Brewton will provide an overview of PFAS. We'll hear about the human health impacts from Jamie Dewitt. We will hear about the ATSDR work on PFAS, including the recently released Toxicological Profile from Rachel Rogers, and then Greta Goldman will provide an overview of the public health costs, or the cost of inaction for PFAS exposure. Those presentations will be followed by some discussion and Q&A. Our second session is focused on EPA policies and how science is informing EPA policies for PFAS in drinking water. And we'll have a series of speakers providing information about what's happening at the EPA, including the recently formed PFAS Council. And we'll have some Q&A after that as well. And I did want to just highlight that this is the first of 2 webinar series or sessions. And the second is on June 10th, same time. It'll be a slightly different format. We'll also have start out with some presentations. It's focused on how states throughout the US are responding to contamination. We'll hear about the impacts on communities, environmental justice concerns, and then have an opportunity for some small breakout group discussion. So we hope all of you can join us as well on June 10th. So I did want to just share a few technology notes as we're getting started here. I know we've all spent a lot of time on Zoom over the last few months, or the last year perhaps, but just in terms of how we are planning to use technology or Zoom in our webinar today, we do ask that if you, for the question and answer, the facilitated discussion sessions, ask you to put your questions into the Q&A pod, and if possible, specify who the question is for. And so just on my screen, you should see an example of how to do that if you're not as familiar with the Q&A tool. You should, at the bottom of your screen, see a small Q&A button. You can click on that and a box will pop up that says question and answer. You can enter your question into the box below. You have a choice to send it anonymously. Make sure, if you're curious, you can click on this option to see who can see your questions. It is public, so unless you, but if you click to share your question anonymously, no one will see who submitted the question, but everyone will be able to see the questions that are submitted. And then we also have the option to upvote. So if you see someone else has submitted a question that you really like, or you think you'd really like to have answered or discussed, go ahead and click that thumbs up, and that will indicate to the organizers that that's an important question for you. We also do have the chat turned on. As a reminder, make sure you're being careful about who you're sending that chat to. You might be able to make sure if you want the chat to go to everyone, make sure that that's selected. And if you only want it to go to panelists, make sure that that is the option that you're using. And we ask you to put your questions into the Q&A pod. And if you want to share resources, make comments, you can go ahead and use the chat feature. The session is being recorded, so it can be shared afterwards as a resource. So I want to make sure everyone is aware of that. And we'll talk a little bit more about next steps at the end of the webinar, but we will be sharing a survey as well as the recording and the presentations as resources. So with that, I think we can go ahead and turn to our first speaker, Tom, who will be providing that overview of PFAS. And so Tom, if you want to go ahead and start sharing your screen, I'll turn it over to you.
Sure thing. Thanks, Maya, and hello, everyone. Is that share working?
It is, yes.
Okay, great. So as you heard, I'm Tom Brewton with the Green Science Policy Institute. We are an NGO out of California, and we work to reduce the use of hazardous chemicals. I'm an environmental engineer by training, and my background is in cleanup of contaminated sites. My task for today in 10 minutes is to give you the broadest of broad overviews of the issue of PFAS in drinking water. So let's get started. PFAS are per and polyfluoroalkyl substances. These are a large family of human-made chemicals. And the thing that defines them is their chemical structure. So they consist of carbon atoms, and those carbon atoms are surrounded by atoms of fluorine. And the bonds between carbon and fluorine are some of the strongest bonds in organic chemistry. And the net effect of these carbon-fluorine bonds is to give PFAS really interesting and unique chemical properties. On one hand, PFAS are very useful in lots of products and industrial processes. Most famously, we think of PFAS as surface treatments for making things non-stick or making things repellent to oil, water, and stains. Now, the downside of those carbon-fluorine bonds is that they also make PFAS very persistent. PFAS are chemicals that break down very slowly in the environment, so slowly, in fact, that they've been dubbed forever chemicals. And the problem with that is that chemicals that don't break down can build up in the environment. They can accumulate in food chains or in water systems, and that can lead to elevated exposure for biota and for people. The chemicals that I'm showing here on this slide are two of the most well-known, well-studied PFAS, chemicals known as PFAS and PFOA. These are some common uses of PFAS, and I won't say each of these out loud, but I show this just to give you a feel for the array of places where PFAS show up in the products that we use and are around us. One that I will point out that's been particularly important as relates to water contamination is firefighting foam. And the reason that it's different is that unlike the rest of these products, firefighting foam is designed to be sprayed on the land surface. And so unless a lot of care is taken to collect that firefighting water, then the use of these foams is unfortunately a very efficient way of getting PFAS out into the environment. And so for chemicals that are used in so many different types of products, PFAS have really flown under the radar for a long time, or they did. And this slide reflects that. This is showing the number of scientific publications on PFAS over the years. And you can see that up until around the year 2000, there really wasn't a lot of research going on. But then since then, there's been a big, almost exponential increase. Part of what's going on here is that the analytical tools for measuring PFAS are around the early 2000s got much cheaper, much better, and more widely available. And so when scientists were able to measure PFAS, that opened up the possibility of doing more research, and that's what's happened. And as a result, in the past 15 or 20 years, we've learned a lot about this class of chemicals. We've learned, for instance, that PFAS are ubiquitous in the environment. These are some headlines just from the last year. So for instance, PFAS were detected in the snow near the top of Mount Everest. They were detected in seawater in the Arctic, and also even in alligators in North Carolina. And these are just examples. I could come up with slide after slide of these types of headlines because pretty much anywhere where chemists look in the environment, they detect PFAS. Another thing we've learned is that virtually all of us are exposed to these chemicals. Biomonitoring data from the CDC shows that nearly 100% of US blood samples contain detectable levels of PFAS. And that's a concern, as you'll hear from the next speakers, because the forms of PFAS that are most well studied are linked to a number of adverse or increased risk of a number of adverse health effects. We've also learned that PFAS are widespread contaminants in drinking water. Several years ago, the EPA required certain water utilities, lots of water utilities around the country, to monitor for 6 different PFAS in the source water for their drinking water systems. And we and some collaborators did an analysis of the data that came out of that program known as the UCMR3 program. And we calculated at that time that up to 6 million people lived in places where source water contained levels of PFAS and PFOA above EPA's health advisory of 70 nanograms per liter. That number, 6 million, is pretty big, and the study got a lot of press when it came out. But in the 5 or so years since that study, our understanding of the number of people who are affected by PFAS in drinking water has just gone up. And now it's common to hear people say that this is an issue that affects hundreds of millions of people. And as time has gone on, there's been more and more testing of drinking water. And the Environmental Working Group keeps a really nice database of all the detections of PFAS in drinking water. And that's where I pulled this map from. And what you can see is that it looks like the problem is much worse in some states than in others. And for sure, some states have more than their fair share of PFAS contamination sources. But I would posit that what's really going on here is that some states have been much more proactive than others at going out and doing monitoring for PFAS in water. For instance, if you look at Michigan and North Carolina and maybe New Jersey, they appear to be almost entirely colored out with dots. That's because those states have been proactive about putting together monitoring programs. And so I fully expect that as other states start to do this work, this map is going to fill in. And as states go out and look for PFAS, they're going to find it. Another thing we've learned is that PFAS, at least the PFAS that have been studied a lot, can be toxic at quite low levels. And this chart shows how drinking water health guidelines for the chemical PFOA have changed over the years. And I say change, but I should really say they've gone down, because that's the direction that this graph goes. So if you look back 20 years ago, health guidelines were being set at 10,000 parts per trillion or in excess of that. But in the last few years, a number of states, a growing number of states, have set health advisory levels down even below 10 nanograms per liter parts per trillion. And so that's a difference of 1,000 to 10,000 fold. And it's a reflection of our growing understanding of the toxicity of this particular chemical. PFAS can be removed from drinking water, fortunately, but it's expensive. This is an example from North Carolina, where there's a PFAS production plant on the Cape Fear River. A few years ago, it was discovered that this plant was emitting PFAS pollution into that river, which serves as a drinking water source for more than 100,000 people downstream. And so as a result, those downstream communities have been scrambling to install advanced water treatment facilities to remove the PFAS. And this is expensive. As of a couple of years ago, when this particular news article came out, one utility was planning to spend $46 million to build an activated carbon filtration plant. And another utility across the river was budgeting $99 million to build a reverse osmosis filtration plant. Both of these facilities were estimated to have operating costs of in excess of $2.5 million a year. These are really large costs for communities to bear. And unfortunately, North Carolina is not the only place where this kind of situation is playing out. Another thing that makes PFAS a vexing issue is that there are so many of these chemicals. The latest estimate from the OECD is that there have been more than 4,700 different PFAS in commerce. And that's, other authorities would say it's hundreds, other different authorities would say it's even more than 4,700. In any case, it's a big number of chemicals, and it has some scientists thinking that the traditional paradigm that we've used to assess the safety of chemicals that works one chemical at a time is just not going to be sufficient to deal with all of these PFAS. We published a paper to this effect last summer, and our main points were that the extreme persistence and potential toxicity of all PFAS make this entire class suspect, that there's not enough time to study them all using the traditional one-by-one approach. And so instead, we should focus on avoiding their use whenever possible. And that brings me to my big take-home point, which is that PFAS are problematic and difficult to clean up, and that prevention is preferable, and that PFAS should only be used when necessary. Fortunately, there are things that states can and are doing along these lines. I think Bevan did an awesome job of summarizing them at the beginning, and hopefully we can talk more about them during the Q&A. If you have any questions, feel free to follow up with me in an email. And if you'd like to learn more about what we do or about PFAS, please check out our websites here, greensciencepolicy.org and pfascentral.org. Thanks for your attention.
Great, thank you so much, Tom. I now want to turn to Jamie, Dr. Jamie Dewitt, to present on the health impacts. And just as a brief introduction, apologies, Tom, I didn't do this for you, but Dr. Jamie Dewitt is an associate professor at the Department of Pharmacology and Toxicology at the Brody School of Medicine at East Carolina University, and her lab is currently assessing the immunotoxicity of emerging PFAS that are of concern in North Carolina. And so, Jamie, I'll turn it over to you for your slides. Thank you.
Great, thank you. And thank you all for inviting me to present to you about the health impacts of PFAS exposure. Before I get started, I'd just like to share that I am funded to study the health effects of PFAS, and I do serve and have served as a plaintiff's expert witness in cases involving PFAS. This slide should highlight to you that the health effects of exposure to PFAS from drinking water does not impact just a single organ. We call PFAS multi-system toxicants. In other words, studies of people exposed to PFAS through their drinking water demonstrate that multiple systems and multiple organs can be impacted in terms of adverse health outcomes. These can range from effects on the endocrine system, effects on the liver, effects on the immune system, effects on development, effects on reproduction. So your takeaway is that these compounds have the potential to induce many different types of health effects. Another takeaway that you might get from this figure is that some of these health effects are linked with higher degrees of certainty and lesser degrees of certainty. And I'd like to talk a little bit about what we mean by high certainty when it comes to health effects of PFAS and extension, other environmental contaminants. So why are some of these outcomes associated with high certainty? When we study the health effects of PFAS, we can do so from many different approaches. On one hand, people may look at the effects of PFAS in cells, in a dish, and ask about whether PFAS kill the cells or change them or induce mutations. This is a very quick method to evaluate the potential ability of PFAS to affect health of living organisms. It's fairly rapid, but it's not fairly relevant to what's happening to people who are exposed through their jobs or because of where they live. Other approaches would involve asking questions about what PFAS do when they're actually given to living organisms or experimental models. These might be mice or zebrafish or rats or even non-human primates. These are a little more relevant to people because these are typically vertebrate organisms that go through their lives doing similar things that people do, eating, breathing, sleeping, etc. They can be somewhat time-consuming and expensive, and there are some ethical concerns, but this will give us information that's a little bit more relevant to what's going on inside of people. Epidemiological studies are studies of human populations that have been exposed to PFAS because of where people work or because of where they live and what they drink are going to be highly relevant to helping us understand links between PFAS exposure and health outcomes. Epidemiological studies may include specific studies designed to ask questions about populations with specific types of exposure. And we also might get information from medical monitoring studies of people employed in certain industries and biomonitoring studies, such as those conducted by the Centers for Disease Control and Prevention, to give us information about levels of PFAS inside of people's bodies. So each of these different areas can give us information about what PFAS do to health. When we have higher certainty, it means that we have many different sets of data across this spectrum of studies, and that these types of data are from well-conducted studies that are in agreement with one another. For example, if we observe that the vaccine response is suppressed by exposure to PFAS in humans, and we also see that response in an experimental animal model, that gives us a greater degree of certainty. So our certainty in health effects is increased by what we call the weight of evidence, or the accumulation of high quality data that are in agreement with one another. Now, I'm not discounting that individual studies can contribute important information, but the body of evidence gives us greater certainty about links of PFAS exposure to certain types of health outcomes. One really great review of the types of health outcomes that have been linked to PFAS exposure through various media, whether it be drinking water or food or air, is a recent toxicological profile put out by the Agency for Toxic Substances and Disease Registry. And you're going to hear a little bit about this from our next speaker. What the ATSDR did is went through data, and this is about a 700 to 900 page document if you'd like to take the time to read it. They went through accumulated data and said what health effects stand out as having the strongest links to PFAS exposure, and to which PFAS are these health effects linked. Now, they only evaluated 14 PFAS, and as you heard from Tom, there are thousands of PFAS. So this is just a small piece of the PFAS puzzle, but you can see the same types of health effects are listed here that I showed on that earlier slide. And the toxicological links are those studies in experimental animals that give us confidence that what we've observed in the epidemiological studies are true effects and not confounders or artifacts from other types of comorbidities that people might be experiencing. Studies then with lower certainty, or health effects with lower certainty, are not necessarily bad studies, but when we have lower certainty about health effects, it generally means that we don't have enough information to have the confidence that we need to have to definitively say this effect is strongly linked or caused by exposure. It usually means that we need a little bit more information to make a decision with higher certainty about those health effects. And remember, only a handful of PFAS have really been studied for their epidemiological effects and for their toxicological effects. Some reports indicate that there might be 10,000 individual PFAS. But when we combine what we know about the relatively small number of PFAS that have been studied with their environmental persistence and their ability to move from the environment into the bodies of living organisms, it tells us that PFAS are problematic for human health and have the potential to change rates of disease in states among different populations because of where people live and because of where they work and to what they're exposed in terms of PFAS. I wanted to talk a little bit about one of my areas of research, which is the effect of PFAS on the immune system. We're hopefully sliding out of this COVID-19 pandemic, but I know that there are people, especially those living in PFAS impacted communities, who are concerned about the potential for PFAS to affect their immune systems. We've seen from epidemiological studies and toxicity studies that PFAS can suppress the immune system. What this specifically means is that we've seen that exposure to PFAS can reduce the body's ability to make an appropriate response against a vaccine. I just got my COVID vaccine a few months ago. If I was exposed to PFAS, does that mean I'm not protected? Does that mean I have an increased risk for getting COVID if I don't continue to wear my mask and socially distance? We don't know because we haven't really answered or assessed those questions yet, but we do know that at least for PFOA and PFOS, suppression of vaccine responses is a real outcome associated with their exposure. And other PFAS have additional PFAS have more evidence that they have the potential to affect the vaccine response as well. We have one study that's been conducted and published on the association between PFAS levels in blood and the severity of a COVID response. This was a study done in Denmark, and the study authors looked at levels of PFAS in the blood of people who later had COVID infections. And they asked, was there a relationship or a link between levels of PFAS in blood and the severity of a COVID response once these people were infected? As you can see from the graph, one of the PFAS, it's known as PFBA, and we call it a short chain PFAS. One of the PFAS was associated with a more severe COVID infection. In other words, people who had higher levels of PFBA in their blood had a more severe COVID response, regardless of whether they were men or women. So those people either succumbed to their COVID infection or they had to be hospitalized in the ICU. This is just one study. And as I said, we have not accumulated a weight of evidence about PFAS exposure and COVID, or even PFAS exposure and the vaccine response. But the evidence that we have about PFAS in the immune system suggests that we need to be concerned about people exposed to PFAS and how they're going to respond to the vaccine and how their risks to COVID have been expressed throughout this entire pandemic. But the bottom line is that yes, while we know that PFOA and PFOS and potentially other PFAS can impact the immune system, we do know that getting vaccinated is still going to provide the immune system with that additional boost that it needs to protect itself from COVID. Similarly, for other types of vaccines, including childhood vaccines, even if the immune system is suppressed, a vaccine is going to give the immune system the extra tools that it needs to fight off the disease. But as I mentioned earlier, we only have low certainty associated with this outcome because we haven't generated the data to fully assess whether PFAS exposure is linked to a more severe COVID outcome or to a reduced vaccine response. I look forward to hearing your questions, and I am happy to hand off the presentation to our next speaker. Thank you for listening.
Thank you so much, Jamie. Really helpful to get that overview of the health impacts. And you did reference our next speaker, Rachel Rogers, and some of the work that she'll be speaking about that's happening at ATSDR. So Dr. Rachel Rogers is an environmental health scientist at NCEH ATSDR in the Office of Science, where she serves as scientific lead for the NCEH ATSDR PFAS community of practice and provides technical oversight and coordination for all the PFAS related work that's happening there. So Rachel, I'll go ahead and turn it over to you, and thank you.
Great, thank you, Maya. Is my screen share working properly?
It is, yep.
Okay, fantastic. Okay, hi everybody. Like Maya said, my name is Rachel Rogers, and I'm an environmental health scientist with the National Center for Environmental Health and with ATSDR. And I've been working here to address concerns related to PFAS for almost a decade at this point. I'm currently serving as the scientific lead for the NCEH ATSDR PFAS community of practice, a role in which I am able to provide technical guidance and oversight for all of the PFAS activities across the center. So I'm really excited to be here with you today. I'm going to be talking a little bit about how ATSDR is engaged to understand and address the impact of these chemicals in communities all over the United States, and specifically how ATSDR uses basic science to inform public health decision-making. So before I launch into the technical details of our PFAS work, I do want to say a little bit about ATSDR. We are a small federal public health agency within the Department of Health and Human Services, and we're a sister agency of the Centers for Disease Control and Prevention. We share leadership with the National Center for Environmental Health, NCEH, and our primary mission is to help identify and reduce exposures to hazardous chemicals. So we work to identify how people in a community might be exposed to chemicals, and we attempt to determine if there is an exposure that represents a threat to human health. Our mission is to protect communities from harmful health effects associated with exposure to hazardous substances. We do this by responding to emergencies, by investigating emerging threats, by conducting research and building capacity within our state and local partners in order to respond to public health concerns. We get requests for support from federal partners, from state and local agencies, from community groups, and from individual residents. When a request comes in, we assess the existing environmental and health data to determine whether people are at risk because of their exposures. And then we make recommendations to people like the EPA or to state and health environmental agencies and other stakeholders to stop or prevent harmful exposures from occurring. So we're currently involved in PFAS-related activities and investigations across the country, as you can see here on the map. In addition to 9 ongoing research studies, we're conducting numerous site-based activities. So ultimately, our goal with this work is to determine where and how exposure is occurring, to understand the relationship between PFAS exposure and the risk of health effects, like what Jamie just talked about, and also to identify and implement strategies to help prevent exposures in the future. The National Defense Authorization Act has authorized ATSDR to tackle a robust series of projects that are aimed at first understanding and characterizing PFAS exposure through drinking water specifically, and then building what we know about how those exposures may impact health. So first, as you can see described in the bottom left of this triangle, ATSDR is conducting exposure assessments in communities near current or former military bases that are known to have had PFAS in their drinking water. Then the P study, which is described in the bottom right of the triangle, is the first site of our national multi-site health study, which will look at the human health effects of PFAS exposure through drinking contaminated water. And then finally, as you can see at the top of the triangle, ATSDR has provided funding for 7 partner groups across the nation to conduct the multi-site health study to expand the science on how drinking water that contains PFAS may harm health. So as Jamie kind of primed you guys for, one of the primary ways that ATSDR works with basic science is through the development of our toxicological profiles. So these tox profiles are part of our congressional mandate, and we develop them for chemicals that are found at national priorities list sites. So just a few weeks ago, we released an updated version of our tox profile for PFAS. This document is very long. It is a comprehensive summary and evaluation of all of the available toxicological and epidemiological information that's been published about PFAS. The document is extensively reviewed by many federal partners and very top of their field scientists before it's released. And this version of our tox profile for PFAS captures all of the peer-reviewed literature up to March of 2020. So one of the most important things about the tox profile, in my opinion, is that it's where we publish our minimal risk levels, or MRLs. MRLs are estimates of the amount of chemical a person can eat, drink, or breathe every day without a detectable risk of a non-cancer health effect. MRLs are daily doses, so they're not directly comparable to other drinking water guidelines that may be developed by the EPA or by states, but they can be converted into drinking water concentrations by doing a calculation that combines them with what we know about the average adult or child body weight, as well as the average adult or child drinking water intake rates. So these drinking water guidelines that we develop from our MRLs are called EMEGs, Environmental Media Evaluation Guides, and ATSDR uses them as a screening tool. Now, ATSDR, like CDC, is non-regulatory, so it's important to note here that neither our MRLs nor our EMEGs are regulatory levels. So this is a really important difference between our MRLs and EMEGs and some of the other state or federal drinking water guidance values that exist for PFAS. MRLs and EMEGs are not intended to be used to define cleanup levels or action levels, but they are a really useful tool for telling us where the public health community needs to look more closely at an exposure. So it's really a first screen. As the science grows and as we learn more about PFAS, ATSDR and the National Center for Environmental Health are shifting gears to get ahead of the emerging concerns that are related to PFAS and to address the evolving needs of the communities that we serve. So we're trying to learn as much as we possibly can from our existing cohorts. We have quite a bit of work ongoing, quite a number of cohorts that are already in place, and we're doing everything we can to learn as much as possible from that ongoing work. For example, we're currently developing a collaborative study with the EPA to learn more about non-drinking water sources of exposure. We're developing a protocol to combine the existing exposure assessment data that I mentioned earlier with additional environmental measurements and information about lifestyle and diet. Ultimately, we are hoping to be able to identify and to characterize the non-drinking water exposures that are contributing to PFAS body burden in some of these communities. We're also developing a follow-on study that will recruit from our exposure assessment cohorts to better understand a lot of what Jamie was talking about how PFAS affect the immune system and what that means for susceptibility to viral infection, including but not limited to COVID-19. So there's evidence from human and animal studies that PFAS exposure may reduce resistance to infectious disease. We plan to leverage our existing PFAS serum data in combination with surveys about participants and how they've experienced symptoms of viral infection, as well as their experience with diagnosis of COVID-19 and things like flu, in order to determine whether people with higher PFAS exposures and higher PFAS blood levels are more susceptible to viral infection. In order to ensure that healthcare providers are up to speed on the science of PFAS, we're working with the National Academies of Science, Engineering, and Medicine to develop guidance for healthcare professionals who treat patients with PFAS exposures. We know that the clinical community is often the front line, that people go to their doctors when they have concerns about PFAS exposures. And so we're working very hard to make sure that we're providing resources and information to our healthcare provider community so that they can help these people who are grappling with concerns about exposure to PFAS. We've also identified an innovative, forward-thinking research agenda to address important research gaps moving forward. As we move our PFAS research agenda forward, we're grappling with how to transition from a reactive approach in which we address contamination identified through biomonitoring or water testing to a more proactive approach in which we can potentially identify populations that might be at greater risk of exposure to PFAS. As we strive to learn more about how PFAS exposure may affect human health, we're designing our research studies to increase the likelihood that we can draw strong evidence-based conclusions that can be used in the consideration of PFAS policy and regulations moving forward, even though we ourselves are not a regulatory agency. So thank you for your attention. I'm going to stop there, but I do want to encourage you to check out our website for additional information. There's a lot more detail about our ongoing research, our exposure assessments, our multi-site study. Some of our preliminary data is posted on that site as well. And I'm happy to take any questions when it's time for that.
Great. Thank you so much, Rachel. It's really helpful to hear you describe that recent work and how valuable and how folks can think about using it, as well as the research that's coming up. Our next speaker is Greta Goldenman, who's going to speak about the cost of PFAS, or the cost of inaction. And Greta, I invite you to turn on your video now and unmute yourself. And I believe I'll be sharing the slides for you, so I will pull those up as well. But just by way of introduction, Greta is a semi-retired lawyer and the founder of Milieu, a Brussels-based consultancy. She also coordinates the Global PFAS Science Panel, which is a collaborative partnership dedicated to enhancing understanding of PFAS and informing decision-making. So let me just pull up your slides here, Greta, and
well, thank you very much, Maya, for that introduction, and I'm very pleased to be able to present some of this work to you today. Can we have the next slide, please? This work grew out of a project I led a couple of years ago for the Nordic Council of Ministers, where we were asked to come up with a framework or methodology for how you could estimate the cost to society for impacts linked to PFAS exposure. And then how could you put monetary values onto those costs? We came up with some very large estimates for annual health-related costs, and then for the 20-year view of how much it would cost to clean up PFAS in order to prevent those health impacts from occurring. And these figures, I put them there along with their US dollar equivalent, have been very much cited in Europe as it is moving forward and taking policy interventions to try to limit contact and exposure with PFAS. Next slide, please. So somebody threw out the challenge to me. Well, why don't we try to do the same thing for the United States? So this is our effort to try to meet that challenge. There are very few studies looking at costs of PFAS. We only know about 2 partial studies so far. So we moved forward by establishing a high-level working group, and we took the decision to try to avoid some kind of a broad brush approach, which we'd had to do for the European study, and instead to look in more detail at 2 states. Next slide, please. So we chose New Hampshire and California. New Hampshire, we looked at Michigan, North Carolina, a number of other states, which were very interesting, but we chose these 2 states because they're on opposite sides of the country and very, very different. But they do share the fact that neither of them has been the site of primary production on PFAS. So in that sense, the types of contamination problems that they are facing are similar to what states are facing across the country. So in New Hampshire, it's a small state. It's been very engaged in looking at PFAS for the last 5 years because of 2 particular sites that are quite different in the sources of PFAS that they have. Highly engaged civil society. The state has taken a lot of action. There's a lot of data available there because of statewide monitoring. They've adopted some stringent MCLs for PFAS, and they're facing some very strong political pushback, including litigation from towns that are being funded by PFAS producers. Next slide, please. Today I'm going to zero in a little bit on California. We chose California because it has a very large and diverse population. One interesting fact is that the PFAS serum concentrations of Californians appears to be higher than the average NHANES data for people in the United States. And water is extremely important in California because of its challenges with drought. So it's looking very closely at its water resources and possibilities for reuse of water. Next slide, please. Here's the problem. The PFAS contamination is pervasive. We know a lot about some of the associated problems, but it's really difficult to get down to what are the real costs that are coming up because of PFAS. Next slide, please. So we started out by trying to characterize California, looking at what were some of the industrial activities being carried out, where PFAS may be used. We ended up with a list of over 800 different industrial addresses in California. And then we decided to go, well, let's go right into where the contamination is happening and what are going to be the costs that are going to be coming up for local governments and for the state. Next slide, please. So in looking at these, I think next slide, you're going to have to run through these slides quite quickly because that's right. Keep running through them. One thing the point I wanted to make with this slide is how these costs, which are significant, are being shifted to states and to local officials and to public utilities. So the cost of finding out what PFAS is out there, this is a significant cost that states are having to bear. And the cost of drinking water remediation is being shifted to the local public utilities. Wastewater, sewage sludge treatment, etc. So it's really important to understand what the extent of these costs are in trying to figure out. And one of the underlying themes of my presentation is, well, who should be paying for these costs? Is it fair that a small town that may have PFAS in the drinking water supply has to incur significant costs in order to clean this up? Next slide, please. In California, we've had a really very useful interaction with some of the state agencies that are working on PFAS. The California Water Resource Boards have been and the Biomonitoring Program have been giving us some very interesting data on the costs that they are incurring in dealing with some of these issues. For drinking water remediation, we used the drinking water monitoring that's undergoing in California right now. Through the notifications through the systems for getting information on drinking water levels that are going back to the state water boards. So we've taken this information, and next slide, please. And we now have some preliminary results for the cost of what we think are, if we think these are fairly conservative figures for what the costs will be for California for drinking water remediation over the next 20, 30 years. Now the big cost item here is on wastewater and sludge treatment. And that is because California in particular, as I mentioned, is trying to reuse water and to recharge its groundwater systems. And so if it's taking that seriously and is trying to recharge groundwater systems with water that has been purged from PFAS, this will incur fairly significant costs in order to carry this out. These are preliminary results, and just want to give you an idea of where we think the big picture items are going to be for remediating PFAS in some of these areas. Next slide, please. So the more controversial area that we are working in is to try to figure out how to come up with costs for the health impacts of PFAS. Now, here we're using a methodology that we developed for the Nordic Council of Ministers study, where we were able to find just a handful of epidemiological studies that were able to come up with some type of risk ratios. What would be the additional number of health outcomes that could be attributed to PFAS exposure, given what had been found out in that epidemiological study. We've divided exposure levels into 3 categories. Occupational exposure, we consider as the highest level of exposure. We really do not have very good figures about how many workers at the 800,000 industries we found are being exposed, but this is also not a very significant number when we look at the numbers of people that might have kidney cancer based on the one epidemiological study we know of that looked at that type of occupational exposure. More interesting are the people who are exposed at a medium level. We've calculated that the number of Californians who are drinking water above the response levels set up by California, which are around 40 parts per trillion. We've calculated that this affects about 19% of adult Californians, or over 5 million people. And here we're working on 2 health outcomes: the elevated risk of all-cause mortality based on an epidemiological study that was carried out in Italy in a heavily contaminated area there, and also the increase in the number of low birth weight births. And then low-level exposure, there we're considering everyone else, because Californians, like the rest of the country, all have PFAS in their body. And there we're looking at the elevated risk of death from hypertension. Next slide, please. Next slide. Here we have some calculations, but they're so preliminary that we did not feel we could really share them with you yet. They're not complete enough yet. The one cost estimate that we thought is far enough along and probably is the one for the 2-year cost for low birth weight births, using another type of cost prediction methodology. what we can tell you is that in that medium exposure level, the all-cause mortality level, we know that that's going to run in the tens of billions of dollars. And we are discussing now some of the issues that are rising around those estimates, and we hope to have some figures for you within a couple of months on that. Next slide, please.
And Greta, sorry, I'm just noticing the time, and we kind of hit the time available for the presentation. And I also know that you are not going to be able to stay on for the question period. So I just want to see if there's any kind of closing thoughts you want to share related to this work before we turn to the Q&A panel.
We're almost through the slides. So can I just have if I could have the next slide? I just want to mention that there are a number of costs which we're not yet able to really quantify. Overall governance costs, research and development, litigation costs, other health conditions, loss of property value, etc. And then the next slide, I'll close with that one. I think the main conclusion we have is that the contamination is pervasive, it's long-term, it's wide-ranging, it's routinely externalized onto the public and disproportionately experienced. These costs are significant and they particularly impact publicly owned utilities. But from our preliminary study, we think that investing in drinking water remediation is cost effective when compared to the cost of the potential health outcomes that are related to that exposure. So we wanted to end by emphasizing the importance of capping current exposure levels by limiting PFAS to essential uses. And let me close there and thank you, all of you, for your attention.
Thank you so much, Greta, for that. Sharing that information. I know you said some of the information that you've shared is preliminary. Do you have a sense for when some of the results of your work might be published?
I think we're going to have, we're hoping to have something out by the early autumn.
Okay, thanks. Great. And I know you indicated that you would not be able to stay for the whole session. So I want to thank you for your presentation, and thanks to all the speakers for your remarks. Your presentations really informative, really provides a really helpful overview and introduction to PFAS. We do have a few minutes for questions before we turn to the EPA session. So I want to invite the other panelists to turn on your cameras and go off mute. And I know that there's also been a lot of activity in the Q&A pod. So thank you to all the participants for putting your questions in there. And some of the questions have already been answered. And so if you're looking at that Q&A pod, you should see kind of a section of open questions and then answered questions. And so if you wanted to see those answers, that's where you can look. And I think maybe the first question that we want to turn to is for Rachel. So maybe Rachel, I'll ask this of you, and then if others have any additional comments, I'll welcome their comments as well. And so the question is really around how kind of the differences between EPA and ATSDR in terms of the kind of how whether they're on the agencies are on the same page around kind of the interpretation of toxicity studies, and would the RFDs or reference doses for chronic effects for PFOA and PFAS be the same, or is there some difference?
Sure. Yeah, I'm happy to answer that one. I saw it a couple of times in the chat box, so I'm happy to address it. I think the short answer is that yes, EPA and ATSDR are on the same page about the toxicological studies. The reality is that the EPA's reference doses and lifetime health advisory and ATSDR's MRLs and EMEGs are intended for slightly different purposes. They're similar, but they're just intended for different uses. And they were also developed at different times. So EPA's health advisory came out in 2016. ATSDR's MRLs and the associated EMEGs have just been released a few weeks ago. So I think a key point to just call attention to is the fact that ATSDR's numbers might be a little bit different from EPA's, in part because they're based on literature over a number of years beyond what EPA used when they were releasing their health advisory and the RFD that the health advisory is based on back in 2016. We also derive these numbers using slightly different calculations, primarily because the use is a little bit different. As I mentioned, the MRLs are really intended to be used as screening tools, whereas the Lifetime Health Advisory is a tool for state governments and state health agencies to use to potentially determine action for water systems and things like that. So they're related, but they're not quite the same thing. I also want to note that ATSDR and EPA are working together very closely in a lot of these communities. When we develop our MRLs and when we write our tox profile, they're reviewed by EPA. We're not operating in a vacuum. And often when ATSDR does a health assessment or evaluates an exposure level in a community, we might use our MRL as a screen, as that kind of first screening step. But we often will also use the EPA's health advisory when we're evaluating whether or not we think public health action is needed in that community. So they are two different tools. They are slightly different numbers. They are based on a slightly different library of literature just because of the timing. But ultimately, it takes all the pieces to do a good assessment in these communities.
Great, thanks. And yeah, I'm just seeing a comment added to the chat, kind of highlighting how that's a communications challenge for the public. And so, as much as that can be clarified through communications.
Yeah, that's a helpful comment, and it's not one we've heard it before. We recognize that it can be very confusing, even for the folks working on these numbers. So I appreciate and agree with that comment, and I guess I'll just say it's something that we work on all the time, trying to communicate those differences to the public, but also to one another.
Great, thanks. We have some other questions in the queue, but I just want to check to see if Jamie or Tom, if you have anything to add to that response. Okay. So I think our next question is for Tom, but I'm sure the other panelists might have something to add to this question as well. But the question is, so for avoidance and minimization, is anyone aware of work to ban the use or replace the use or inform the public so they as consumers can make informed decisions regarding purchases of items that might contain PFAS, like cosmetics?
Okay, sure. That's a question that I'm interested in and can start with an answer on. And the answer to the first part about whether there have been efforts to ban certain uses of PFAS is yes. In the years since 2018, several different US states have enacted bans on PFAS in certain products. I think that Washington with food packaging and firefighting foam was the first one. A few other states have also now banned the use of PFAS in certain types of food packaging. More states have passed similar bills for firefighting foam. Just, I think 2 months ago, Vermont passed perhaps the biggest bill yet that bans PFAS in food packaging, firefighting foam, ski wax, carpets, and perhaps some other things that I'm forgetting. So there is action along these lines. As far as informing consumers, I think that, first of all, it shouldn't be on consumers to have to do this. The more that government can take care of this problem, the better. But we do have a website that contains a list of PFAS-free consumer products that we've been putting together over the past couple of years. We haven't actually done testing of these. These are products where manufacturers have told us, yes, we make this product without the intentional use of PFAS. And so if anyone wants to see that, it's at our website, pfascentral.org. And one other thing I should say is that developments in Europe are exciting along this line. There's an intention there to restrict the use of all PFASs in what they're calling all non-essential uses. So that's potentially a very big restriction.
Yeah,
Thanks.
if I could, I'd just like to add to that, that Greta formed a group called the Global PFAS Science Panel that has been instrumental in defining the essential use concept for PFAS, and has also uncovered myriad uses for PFAS in products and processes about which many of us weren't aware, even those of us who've been working with PFAS for a decade or more. And so this organization is trying to establish some definitions for what is an essential use of PFAS and what is a non-essential use of PFAS. And the hope is that this will enable decision makers to take action to ban those non-essential uses.
Yeah, just one other thing I think is worth mentioning. As the scientific community sort of shifts focus from a focus that's really been looking only at PFAS exposure through drinking water, I think these kinds of questions are going to become more and more important. And one of the things that ATSDR is doing on a research level is to really try to understand how exposures to PFAS through consumer products and through food packaging materials and through these non-drinking water pathways are actually contributing to body burden. We've identified that as a really important priority, because with that information, we can prioritize decision makers in their efforts to remove PFAS from some of these items.
Great, thank you. So we have one last question for Jamie, and I guess I also wanted to check, Tom, if you'd be willing to put that website into the chat pod so folks can just click on the link and easily get there. That would be great. I know I didn't jot it down fast enough.
Absolutely.
Great. So Jamie, the last question we have before we transition to the next panel is for you. And Sandra asked whether you can talk about the validity of scientific assumptions for decreased immune response in mice versus human response.
So one of the responses that we look at in mice is called the T-cell dependent antibody response, or the TDAR. And it is highly analogous to the human vaccine response. So when we see that particular immune function being impacted in mice, we know that it serves as a really good indicator of the potential for that compound being evaluated to produce this similar immune suppression in humans. So it's a really great animal model for being able to predict the likelihood of that outcome in humans. So we're pretty confident that when we see this change in mice from PFAS, that change is likely to be operable in humans. And we've seen that hold true for the epidemiological data.
Great, thank you. All right, well, thank you again to our presenters. Really appreciate all your insights. It's been really informative for me, and I'm sure for the participants as well. I know there are some questions that we didn't get to, but I do want to make sure we have time to hear from our speakers at the EPA. So I know there have been some questions answered in the by typing in the chat. And so to the extent that our panelists are kind of willing and able to do that, that would be wonderful. But I also recognize that we've already taken a lot of your time today. So thank you again. With that, I'm going to invite our panelists from the EPA to turn on your videos. See you there. And I believe, Alex, you might be sharing the presentation. Great, there it is, see it. And just in terms of who we will be hearing from today, I believe we'll start out hearing from Alex Land, who's a physical scientist and policy analyst in the environmental EPA's Office of Water and Office of Groundwater and Drinking Water in the Standards and Risk Management Division, and currently serving as the team lead in developing the proposed drinking water regulation for PFAS. We'll also be hearing from Ryan Albert, who's the Chief of Standards and Risk Reduction branch at the EPA's Office of Groundwater and Drinking Water, and Eric Bernison, who's the Director of the Standards and Risk Management Division for the same office. So with that, Alex, I'll turn it over to you and your team to kick us off.
Actually, this is Eric Bernison. I'll just say a few remarks, and then we'll have Alex speak after that. I want to thank NGA and AAAS for the opportunity to talk to you today about actions at the EPA to address PFAS. Our focus is going to be on drinking water, in part because we were asked to have a discussion about how the agency uses science in developing regulatory standards. I want to assure everybody that the drinking water standard isn't the only action underway in EPA, but we're diving deeply into this so that we can have sort of a robust discussion and presentation about how we use science in informing our deliberations and developing the rule. So we're going to be talking about how the processes work in the Safe Drinking Water Act and how we use that information. And I think it's this presentation following the terrific panel that we just heard from is really helpful. They've provided you the background scientific information on where we stand with the state of science. And our presentation is going to largely focus on how we use that science and making regulatory decisions. So with that, I'm going to have Alex kick us off.
Great, thank you, Eric. So as Maya mentioned, my name is Alex Land. So I'm with EPA's Office of Groundwater and Drinking Water Standards and Risk Management Division. I'm currently serving as the team lead in developing the proposed national primary drinking water regulation for PFAS under the Safe Drinking Water Act. We are excited to join in on this discussion today and sharing our federal perspective on PFAS in drinking water and the importance of the role of science in our decision making. And not to belabor some of the background points that were covered by the other panelists, but as many of you are likely aware, PFAS are a group of synthetic chemicals that have been used since the 1940s. And due to the strong nature of the carbon-fluorine bond, PFAS have properties that make them widely used in a variety of manufacturing, industrial, and commercial applications. These include stain and water repellents used in fabrics and other consumer products, as well as firefighting foams. And because of their widespread use and their environmental persistence, biomonitoring data do show that most people in the United States do have some level of exposure to this group of chemicals. So the agency itself has developed a PFAS action plan based largely in part on the engagements that we have with the public and our stakeholders. And this plan really outlines the major work we have ongoing at the agency. While we're not going to cover a lot of these, ongoing work activities today, I would suggest that you take a look at this document that can be found on our EPA webpage. But I will say that, as the science develops for PFAS, the agency must move forward with actions that are based on this new science in the context of the challenges that many communities are facing. And this administration remains committed to tackling the PFAS pollution and protecting public health and the environment. So as part of this commitment, Administrator Regan issued a memorandum to EPA senior leadership calling for the creation of a new EPA Council on PFAS that is charged with building on the agency's ongoing work to better understand and ultimately reduce the potential risks caused by these chemicals. And to address these challenges and meet the needs of our partners and communities, the administrator has directed the EPA Council on PFAS to in a short term to develop a multi-year strategy to deliver critical public health protections to the American public. And so the development of this strategy will in large part prioritize partnerships and collaborations within the agency and with our federal, state, tribal, and local partners. This strategy will also continue to engage with the public about the risks associated with these chemicals. The strategy will work across all of our national programs and regions in order to maximize our funding and financial programs and to also leverage federal state funds to support cleanup of PFAS pollution, particularly in underserved communities. And lastly, I also mentioned that the development of this plan will also include opportunities for engagement with our stakeholders moving forward. So I want to dive down into and highlight two specific actions that's coming out of our drinking water program. So you may be familiar that in March of this year, our agency reissued our final regulatory determinations for PFOA and PFOS under the Safe Drinking Water Act. With this notice, it initiates the process to propose a national primary drinking water regulation for these two contaminants. And while these determinations discuss two PFAS compounds, we also outline avenues that the agency is considering in terms of evaluating additional PFAS or groups of PFAS as supported by the best available science. And as part of the rulemaking process, there will be opportunities for engaging not only with our Science Advisory Board, the National Drinking Water Advisory Council, but with also members of the public and other stakeholders as we develop the proposed rule. Ryan and Eric will provide some additional insight in terms of the Safe Drinking Water Act regulatory process later in this presentation. The second action that I want to highlight that's coming out of our drinking water program is our recent proposal to monitor for PFAS in drinking water under the Unregulated Contaminant Monitoring Rule, or UCMR. This effort proposes nationwide monitoring for 29 PFAS so that we can better understand the frequency and levels at which these contaminants occur in public water supplies. If finalized, this rule will require sample collection between 2023 and 2025 using approved analytical methods developed by the EPA. And these data will be available to the public once they have been collected and QA'd. This rule has recently just closed public comments, I believe just last month. And so we are currently considering those comments we have received and ultimately expect to publish upon the rule by the end of this calendar year. And so with that, and for the next few slides, and that's diving into more of the regulatory process, I'd like to introduce to you Dr. Brian Albert.
Great, thank you, Alex. And I'll actually be relatively brief. I have just a couple slides I want to discuss about how we tee up to getting to developing the National Primary Drinking Water Regulation. And then Eric will talk about the actual processes and evaluations we consider as we go through that regulation. So Alex, if you go to the next slide. Thank you. So the Safe Drinking Water Act lays out a deliberative process whereby we in the EPA have to go through and evaluate contaminants for regulation in multiple steps. The first step is under the contaminant candidate list here in the top left, that's in the yellow. EPA pulls together a list of contaminants that may be present in drinking water that are candidates for future regulation. We propose the contaminant candidate list. We consider comments on that list and we finalize that list. EPA most recently has finalized the CCL4 and is currently in the process of developing the next contaminant candidate list, CCL5. Now, the other process is for gathering occurrence data. I'm going to show you on the next slide why these data and these processes matter so much. Under the Unregulated Contaminant Monitoring Rule, UCMR program, this is EPA's primary mechanism to gather finished drinking water data that is nationally representative of what's occurring in all drinking water systems. For PFAS specifically, we have existing data for finished drinking water of 6 PFAS that were collected under the UCMR3 monitoring effort from 2013 to 2015. And these data were collected in all 50 states and once again, nationally representative. Now then we use taking what the contaminants that are on the CCL and then also considering occurrence data primarily from the UCMR, we then go to the regulatory determinations process. And what we do is we look through and consider 3 statutory factors to decide whether or not we will regulate or propose or begin the process for regulation for a national primary drinking water regulation for a given contaminant. And I'll talk about that process on the next slide in just a moment. So in the most recent regulatory determination, we made final regulatory determinations for 8 contaminants, 2 of which were PFAS, PFOA, and PFOS, and then for 6 other contaminants, we made a determination not to regulate. After taking public comment on the preliminary regulatory determinations, we make a final regulatory determination. And then from that point, we have 24 months to develop the proposed rule. Now, Eric's going to talk about that process in a moment, so I'm going to skip ahead to this 6-year review. Assuming you go through the process of proposing and then finalizing a rule, every 6 years, EPA goes back and revisits that rule to see if there are opportunities to improve, to meaningfully improve public health protection. And if we identify those opportunities, then EPA can further evaluate a contaminant as a candidate for further rule revision, and we may propose an improved rule and go through the rulemaking process there. Now, just one more quick point. For CCL, UCMR, the regulatory determinations, and 6-year, these are all cyclical processes. You heard me mention we most recently did the CCL4 and are developing the CCL5. It's a once every 5-year process.
Likewise, with UCMR, we're currently collecting data under the UCMR4 cycle. Alex, a slide ago, discussed the UCMR5 proposal that is currently out to collect data on 29 additional PFAS. And then once again, the same thing with the regulatory determinations process. It is a once every 5 years process. We just finalized regulatory determinations 4 in March of this year. So the next one will be due no later than March of 2026. Now, of course, you have the 6-year review. It's a slightly different schedule, but that is what it is. Okay, to the next slide, please, Alex. Okay, and so I'm going to talk about the CIDWA regulatory criteria because they're important in that it sets up the framework for how we initially look at the contaminants when we decide how we're going to regulate them. We consider 3 statutory criteria when we make a determination whether or not to regulate a contaminant. So I'll go through and I'll just talk about the context of PFOA and PFAS, and then I'll mention what the contaminants we made a negative finding on as well, or a decision not to regulate, just for to compare a bit. So the first condition or statutory criteria is the contaminant may have an adverse effect on the health of persons. And as we heard from Dr. Rogers and Dr. Dewitt earlier, the evidence is fairly strong. I should say is very strong. It's not fairly strong that PFOA and PFAS may have an adverse effect on the health of persons. Now, the primary information that we used to inform that determination was our 2016 PFOA and PFAS health effects support documents, which were used as the fundamental scientific information and documents to support the derivation of the health advisories, the 2016 health advisories we had the question about a few moments ago to Dr. Rogers. I will note, while we are very, very familiar with ATSDR's evaluations, they were not yet final as we're going through this particular process. So we did not cite to them heavily as part of our determination. However, we are aware of those products, and we're also aware that they've recently been finalized. There's also a significant body of peer-reviewed literature pointing to the health effects of PFOA and PFAS. This one was a pretty easy yes to make as far as it goes. If you compare it to another candidate or another contaminant, RDX is a contaminant for which we made a negative determination, and we found in that case that it also may have an adverse effect on the health of persons. We'll go to the next criteria here, and this is where we'll deviate between the two. So the next one is the contaminant is known to occur, or there's a substantial likelihood that the contaminant will occur in public water systems with a frequency and at levels of public health concern. And so this is really looking at how commonly is the given contaminant in finished, that is treated drinking water that's flowing to homes and communities across the country. So we primarily use those UCMR data to show it's known to occur. However, there are several other different data sources we consider as well, including several states have been out collecting data that are newer than some of the UCMR data. And because they're using EPA methods that have been that are newer methods, sometimes they have lower reporting limits as well. And so it is able to give us a bit more insight than the UCMR data alone will give us. So once again, the UCMR are the prime data set we look at, but we absolutely do consider the other data that are being collected as part of this, as part of our evaluation. We also can use the substantial likelihood factor, and where we consider many of these other data sets as well. And then the final criteria, and this one, it really includes a lot of different things. In the sole judgment of the administrator, regulation of such a contaminant presents a meaningful opportunity for health risk reductions for persons served by public water systems. And we really do consider a lot of factors here. We consider about the various population exposed. We consider the severity of the adverse health impacts. We consider things such as the persistence of a contaminant. Is a contaminant present that may rapidly decay, may only be around for a few days, or is it something like PFAS that once it's in the environment, it stays in the environment an awfully long time? We consider whether or not there's analytical methods to sufficiently evaluate the risk from the contaminants and also the treatment efficacy from the contaminants. We consider treatment technologies. Are there treatment available to remove a given contaminant? And one thing we've really considered this last cycle as well is public concern and input. And we can say as scientists, on one hand, we really need to be looking just merely at the health effects, merely at the occurrence, and make these determinations. But it does matter what the public thinks. And if the public is generally highly concerned about these contaminants, and this in and of itself causes all sorts of secondary public health impacts, we need to put extra focus on a given evaluation. And so we did consider that as part of the meaningful opportunity determination. Now, for both PFOA and PFAS, we found that they were both known to occur and that there was a meaningful opportunity. So we made a positive determination to regulate these two contaminants. In the case of RDX, the other contaminant I mentioned, it was really low occurrence levels above the health benchmark we used. And so we made the determination that it is not, there's not a substantial likelihood, it's known to occur, there's substantial likelihood, and also as well that there's not a meaningful opportunity. So with that, I will pivot and let Eric talk about the meat of the regulatory program and some of the factors and analyses that we're going through today.
Thank you, Ryan, and thank you, Alex, for getting us to the point where we are right now. So now we're pivoting in this presentation from analysis, descriptions of analysis and actions that the agency has taken to ongoing work within the agency. And I'd like to just sort of talk to you a little bit about the steps involved in developing a national primary drinking water regulation in accordance with the Safe Drinking Water Act. So the statute is a public health driven statute. And so one of the first steps in developing a national primary drinking water regulation is to develop the maximum contaminant level goal. So this is a non-enforceable value, which the statute specifies needs to be set at the level at which no known or adverse effects on the health of persons occur, and which allows an adequate margin of safety. The statute is very clear that we need to use the best available peer-reviewed science and data collected by accepted methods. And that we have to present information on public health when we're promulgating these standards in a way that's comprehensive, informative, and understandable. I want to talk about some of the questions that we've gotten. Alex, if we go back to that last slide. Some of the questions, appreciated Rachel's statement about her response to the questions about EPA and CDC and ATSDR's positions on the science, and state my agreement. We've worked and collaborated with our colleagues at ATSDR and are continue to do so. But I also want to highlight a point that Rachel has made, which is the science on PFAS is constantly evolving. There's more science. There was more science available for ATSDR when they did their MRL values than we had in the agency back in 2014, 2016, when we were developing the health advisories. And even since ATSDR values have come out, and between the time that we'll be proposing a standard, there will be more science for us to consider. So we will be using the best available science in developing the values associated with the MCLG. And I also happen to notice our former colleague, Denise Keener, had asked about other routes of exposure in the Q&A. And while I'm not going to endeavor to answer all of the questions in the chat box, I certainly can't miss an opportunity to respond to Denise, where she asked about other exposure routes. She's particularly asked about fish exposure. So an MCLG derivation for contaminants where there's no threshold will include a consideration of what's called the relative source contribution, where we consider what the amount of exposure is through other routes. Now, Denise, we don't break it down by specific ingestion types. So we wouldn't necessarily identify the amount that's coming from fish as you had asked, but we certainly would be thinking about the non-drinking water exposure, which is an area that we, Rachel mentioned, we're collaborating with ATSDR on to try and get better data to understand how much PFAS exposures comes from non-drinking water sources, so that we can appropriately set an MCLG at a level that considers those other routes of exposure, so that the drinking water exposure doesn't result in a total exceedance of the safe dose. So go ahead, Alex. We'll go ahead and go to the next slide. All right, so in addition to the health effects evaluation, another critical and important part of the evaluation has to do with the technologies that are available, starting with the treatment technologies. So we have to, in accordance with the Act, identify available technologies for the contaminant removal. And we have to consider two classes of systems when we do this. There's about 150,000 public water supply systems in the country. And the vast majority of these systems actually serve very small populations and have very limited resources in terms of operators, technical and managerial and financial capacity. So we have to identify technologies that these very small systems can operate. Now, I should note, when I said 150,000 systems, that includes transient non-community systems that don't serve the year-round population. So there's about 68,000 systems that actually serve resident year-round populations where we're concerned about the more chronic exposures. But even in that universe of community water systems and non-transient, non-community water systems, they're still dominated by these small water systems. We have to identify technologies that are affordable for three categories of small systems, and it is probably the smallest of these categories, the systems serving 25 to 500, that represent some of the biggest challenges because of their limited financial and operational capacity, and because those systems don't enjoy the economies of scale that larger systems have in terms of reducing the costs on a per household basis. So that's an important evaluation that we have to go through. We also have to identify the best available technologies. This is largely driven by what the larger water systems can do. And the statute requires that we can only consider technologies that have been examined under field conditions, that we consider the ability of these treatment technologies to remove the contaminants and the costs for those technologies. Next slide, Alex. So that treatment evaluation is very important when setting the enforceable maximum contaminant level, because what the statute says is that we must set the maximum contaminant level as close as is feasible to the maximum contaminant level goal, and that we need to take costs and benefits into consideration. So we evaluate how low a level of the contaminant, or how close the treatment technologies are, and I'll talk about analytical methods, but those sometimes come into play. Sometimes we have to consider at what level we can quantify or measure the contaminant in drinking water. We take those factors into consideration, and we take into consideration the costs and benefits of removing those contaminants on a national basis when setting the enforceable MCL. Now, an MCL is not the only type of national primary drinking water regulation that we will establish. Safe Drinking Water Act is clear that there may be situations where it's not economically or technologically feasible to ascertain the level of the contaminant. Then we can propose what's called a treatment technique. And the statute requires that treatment technique has to prevent known or anticipated adverse effects to the extent feasible. So feasibility is still another factor when it comes to establishing treatment techniques. And that the treatment technique must minimize overall risk by balancing risks from the contaminant and from other contaminants, the concentration of which might be affected by the treatment technique. So a typical or an example of a treatment technique regulation would be our surface water treatment rules, which are designed to address a multitude of viruses, bacteria, and other pathogens. Too numerous for which there are not necessarily methods, and there's too many different types of pathogens out there. So what we've established are treatment technique requirements for the removal of turbidity and disinfection to assure that the water that is treated from surface water sources is treated to the extent feasible to reduce the risks from those pathogens. So that's the type of an example of a regulation. It could be an approach that the agency could take in the case of PFAS. Next slide. So I mentioned in the last slide that measuring the contaminants is very important. We have to have consistent analysis, analytical methods that can be used to measure the contaminant, to have confidence that the concentration at which we're measuring the contaminant is a reliable and accurate level of the contaminant that assures that it dependably complies with our national primary drinking water regulations. So the development of methods is very critical to national primary drinking water regulations. As Alex mentioned, the agency has now 2 approved analytical methods, which are being incorporated into the UCMR5. Those are methods 537.1 and methods 533, which are capable of measuring certainly PFOA and PFAS at very low levels, as well as 27 other regulated or not regulated PFAS. Next slide. Health risk reduction cost analysis is a very critical and important part of the agency's consideration, as I mentioned in the discussion about setting the MCL. HRCA, as we call it, or as most people refer to it, as a cost benefit analysis, CIDWA requires that we conduct an evaluation and we consider both the quantifiable and the non-quantifiable benefits associated with removing the contaminant or co-occurring contaminants that might be removed. We also have to consider the costs of the removal of those contaminants to the water systems and to the states. We have to consider the incremental cost and benefits of all the alternative regulatory requirements that we're considering. There's a very specific requirement that we consider not just the general population, but the sensitive populations. And the statute lays out examples, including infants, children, pregnant women, and the elderly. That has to be considered in our cost-benefit analysis. We also have to consider the fact that there might be increased risk that might result from compliance with the proposed standard. There might be increased risks from exposures to other contaminants or other factors that could come into play. And then we also have to consider other factors, including the quality of the information that's being used to estimate the costs and benefits. Next slide. So when we propose the drinking water regulation, statute requires that the agency not just prepare an analysis of the costs and benefits. We also have to make a determination at the time we propose the regulation as to whether or not the benefits of what we're proposing for a maximum contaminant level justify or do not justify the costs. Now, the statute does provide authority if there are situations in which the agency finds that benefits do not justify the costs. The agency has the authority to set the MCL at a level at which health risk reduction benefits are maximized at a cost that's justified by the benefits. But that's a discretionary authority that the agency has at its disposal. And I do want to emphasize the term justify. So the statute does not say that the benefits have to exceed the costs. And I also would note that the statute is very clear about the agency's ability to consider both quantified and unquantified costs and benefits in making this judgment. Next slide. So as has been discussed by other presenters, EPA can't do this work in isolation. We need to consult with our stakeholders and we need to consult with experts out there. So there's a number of consultations that we'll be undertaking. Starting with the agency's Science Advisory Board, we'll be seeking recommendations from the Science Advisory Board before we propose this rule. We'll also consult with our National Drinking Water Advisory Council, both at the time we propose and promulgate. We'll consult with our colleagues in the Health and Human Services, of which I would note ATSDR is a part of. And then as appropriate, we'll be evaluating the impacts of any proposed regulation on small entities, small water systems in particular. And if we have a significant impact on small entities, we may have to undertake a small business advocacy review panel in accordance with the Regulatory Flexibility Act. We'll be consulting with state and local government officials in accordance with the UMRA, as well as Executive Order 13132. We'll be talking to our tribal partners, as well as consulting with environmental justice groups about any disproportionate impacts that a regulation might have. And then prior to proposal, we submit any regulation for interagency review in accordance with 12866, Executive Order 12866, for review by other federal agencies. Next slide, Ryan. So we'll propose that regulation, and then we'll probably get quite a few comments on any proposed regulation that we receive. We're gonna have to consider all of those comments that we get on the regulation, address them in accordance with the Administrative Procedures Act. We'll be consulting again between proposal and final with the National Drinking Water Advisory Council and our colleagues at Health and Human Services, and then submitting a final rule for interagency review through the Office of Management and Budget. So that's the process, right? Alex, I think the next slide is, right. So let's just review again the timeframes that we have here. So these represent the statutory timeframes. And so these are the timeframes in which we have to take these actions. So as Alex indicated, we made a regulatory determination for PFOA and PFOS. in March of this year. So we have to propose a maximum contaminant load goal on a national primary drinking water regulations within 24 months of that date. And it is our intent to do that. And then once we've proposed that regulation, we have 18 months from the date of proposal to issue a final national primary drinking water regulation. Next slide. So as I said earlier, with the final regulatory determinations, we're moving forward to implement the drinking water regulatory development process for PFAS. We're also, the regulatory determinations outlines avenues the agency is considering to evaluate additional PFAS chemicals and it provides flexibility for the agency to consider groups of PFAS. So we'll be considering those options as we develop the proposal as supported by the best science. We're committed to listening to the public and working with states, tribes, water systems, and local communities that have been impacted to try and identify some flexible and pragmatic approaches that's going to deliver the public health protections that are so critical. So with that, Alex, I believe we're at the last slide, right? Yeah. So Maya, I don't think I've answered all the questions that are in the chat. Would you like to facilitate the Q&A session for us?
I would love to. Thank you for the presentation, really information packed. And like I said at the beginning of the session today, we will be sharing all of the presentations from today on the NGA's website. They're going to post the presentations as well as the recording when that's available. So if folks want to refer back to the information that was in here, that will be available as a resource. And I think maybe the first question we want to ask is related to one of your last points in your presentation around public engagement. And so Josh asks how, aside from the opportunity to submit public comments, what type of stakeholder engagement does EPA envision as a part of the, so I guess this question is specific to the PFAS Council, but as a part of the PFAS Council's mission, how do we all engage? And I think, so relatedly, I know there's also a question kind of thinking about the audience on the webinar today, if there's anything that the states can do to support the EPA in setting the drinking water standard. So two kind of potentially related questions there.
Right. So let me say that there's two levels at which we're talking about actions by the agency. And so we're talking about the PFAS Council, which is sort of a cross-agency group that is designed to sort of integrate and coordinate the multiple regulatory and scientific actions that the agency is taking. And they've got this mandate that Alex talked to you about in terms of developing the strategy. So what we do know is that they do plan to have public engagements. I don't think we have any specific details for you on when those engagements are going to be occurring, but we recognize the importance of dealing with our state partners in developing that overall strategy. We certainly will work with NGA and others to share that information as those engagement opportunities become available. So taking it back down to the level of the drinking water standard, which was one of many actions that the agency's undertaking in the context of the development standard. So I mentioned in the presentation a couple of the specific stakeholder engagement opportunities that we'll be taking. And then I think it's important to note that we work with states quite regularly in the development of proposed drinking water regulations, and we'll be engaging state partners. A state organization that we often work with is the Association of State Drinking Water Administrators, and they will identify key states who are interested in providing technical input as we start to develop regulatory options. So we'll be working through them. We'll also be seeking input at broader forums. I mentioned we'll be holding stakeholder sessions regarding environmental justice and other points. Ryan, Alex, I don't know if there's any other stakeholder opportunities that you'd like to highlight for our colleagues today.
So Eric, I'll just jump in. Thank you. The environmental justice ones, I think, are ones that in particular we should highlight. It is a administrative priority that we consider environmental justice issues as we develop any rulemaking. There are some of the other processes that Eric discussed as well.
In the presentation, we will do a federalism consultation where we seek input from our various state partners. We also will be doing tribal consultations, which will not necessarily include the states, but may include some of the tribal partners in some of those states. And then finally, in addition to the written formal comments, we do intend to have some public meetings. We're still trying to figure out when the best timing for those meetings may be. Typically, we'll do those after rule proposal because we can discuss what's in the proposal more formally and with greater detail. Sometimes it's beneficial to have those meetings prior to the actual proposal itself. So these are all kind of the formal structures. And then finally, as Eric mentioned, ASDWA is a great partner. We always get good feedback from our partners in ASDWA. And it's a great venue for us to hear via the state engagements we have with them there, and then also at the formal conferences and things along those lines.
And I'll just mention that just on a broader level in terms of the EPA PFAS Council, that one of the points in the administrator's memo was to prioritize partnerships and collaborations, not only within EPA, but with our federal, state, tribal, and local partners. And how that will take shape, I think, is being discussed and remains to be seen, but just wanted to highlight that point for folks.
Thanks. Our next question was anonymous, but the questioner asked whether or if the MCL for PFAS is published during the UCMR3 monitoring, how will EPA direct states to handle results that exceed that standard, including communications to the community?
Yeah, a great question, an important one. So one thing to note when it comes to National Priority Drinking Water Regulations, the Safe Drinking Water Act identifies a time frame by which the rules become effective, or actually establishing the compliance dates. And so that generally is a time frame of 3 years following the promulgation. So I don't want to discount the possibility of this particular scenario, but given the analysis that the agency needs to do and the timing that we're talking about, the compliance dates for the PFAS regulation that's going to result from this process are not likely to occur within the timeframes of the UCMR. But there is a possibility, of course. This is a priority, and the agency may consider options for expediting promulgation of these standards. So we recognize that monitoring for contaminants presents risk communication challenges. So one of the things we're committed to do is working with our state partners to develop appropriate risk communication materials so that communities and states are not left to have tools and resources that are available to them to explain what it means going forward. So we'll work to develop those tools, and we would definitely have to explicitly consider the scenarios of how we would move forward with unregulated contaminant monitoring of a contaminant that would then subsequently become regulated. It's a twist I hadn't contemplated before, but we'll definitely need to consider that.
Great. Thanks. So there's a few other questions in the Q&A, and I think you may have spoken to some of these, but one is around the rationale for monitoring so it's related to the last question, but the rationale for monitoring the 6 PFAS under the UCMR again during the UCMR5, and just whether it's related to the more accurate analytical methods or how that.
Yes, I got it. Okay, so there were 6 PFAS that were monitored under the UCMR3, and we're proposing 29 PFAS, which includes a repeat monitoring for those 6 original PFAS. So there's the one simple answer to the question is the National Defense Appropriations Act of 2020 requires us to monitor for all PFAS, unregulated PFAS for which there's an analytical method. So we're required by law to monitor for all unregulated PFAS, which includes those 6 that we've already monitored for. But as the questioner identified, there's valuable information that can be gained from this. We've got a new method out, 533, which wasn't available, and we've improved the method we used previously. That's enabling those new methods, plus the improved performance by laboratories will enable us to measure at much lower levels than we were able to measure before. And then one additional point I would make is the other statutory changes we made with regard to the UCMR is with regard to small system monitoring. We've previously to now been required to do a representative sample of systems serving 10,000 or fewer. We've been required by recent legislation to do a census of monitoring for all systems serving between 3,300 and 10,000. That's an additional roughly a 7.5-fold increase in the number of small systems we'll be monitoring. So there'll be many more systems conducting this monitoring.
Great. Thank you so much. This has been really informative. We've kind of come up against the time to move towards wrap up. So I just wanted to check to see if there are any kind of closing thoughts from you before we transition.
I'd just like to say thank you for the opportunity. It's great to be a part of this panel. It's important conversations that we're having, and I think it's noteworthy that we're collaborating with the states, and we're all struggling with many of the same scientific questions that that we face when it comes to making these difficult regulatory determinations. But it's great that we're all working to achieve improved public health protection, because it's critically important, and the American public's demanding it.
Thank you. Thank you again, all, for coming to the webinar, presenting really informative and, as you said, extremely important work. So moving to closing, I did just kind of want to echo thanks to all of the speakers and all of the participants. Really wonderful set of questions from participants, and appreciate the help from presenters in sharing the information that you did today and responding to the questions. As I mentioned at the beginning of the webinar, we have an evaluation, a survey that we'd love your input on, just kind of a little bit of feedback on the sessions today. I think my colleague will put that into the chat pod, so you can look for it there, as well as we'll share it by email with a follow-up email. We will also make the presentations and recording available on the National Governors Association website. And as a reminder, there is another session on June 10th. I know many of you have registered for that session. Same time, slightly different format. We'll be in a meeting instead of Zoom meetings instead of webinars, so we'll all get to see each other and interact in breakout sessions. So those are all kind of the logistical closing comments for me. I want to turn it over to Bevan to share some of your reflections and close us out here.
Well, thanks, Maya. And I think this was really helpful to bring the health advisors together with the water advisors, and really take a closer look behind the science that is informing the policies, and also the intricacies and procedure and processes that is required to establish a national drinking water standard. I'm a water person, and I've got to admit, I don't even understand all those steps myself. I want to watch this webinar again to think about all those different steps. But I think we did hear that the science does show that there are health impacts. There some serious health impacts, and it looks like EPA does believe it's occurring in a level where they do need to set a standard. They do have to look at cost and treatment technologies and cost for all of those small water utilities. And so those are some of the complications of why it takes so long. And then, toxicity, that's, a complicated thing when you're looking at the toxicity and the values that the health community is using to make a call on whether, some health interventions need to be taken. And then it's a different standard or a different methodology or but they're informing each other on whether water treatment needs to be employed. So it's a lot of moving parts, but it's really important that the water people come together, the health people come together, and the governor's policy people come together so they can all work on this very serious issue that is really important to the public, and the public is much more well-informed about water quality issues in the past, decade or so. So I want to thank all of our colleagues at AAAS and Resolve for hosting this today, and encourage you all to join us for the next part, and really thank EPA and all the wonderful scientists here today that were helping inform all of the governors and helping them make progress on this issue. So with that, we will close out the meeting, and we'll see you next Thursday.